This modifier video is going to cover modifiers 24 and 25. 24 says unrelated evaluation and management service by the same physician or other professional during a post-op period. So notice it says evaluation and management. That is an E&M code. It's a specific kind of code. You probably have heard of that. You've probably already started coding, and that's not a new phrase to you. So this modifier 24 can only be added to an E&M code, not a surgical code, not a radiology code, nothing except E&M. Okay? And what it says is that you did something during a post-op period that was not related to what they had surgery for. So, let's say a woman has a hysterectomy, okay? So, she had a hysterectomy, and we're in ectomy. Apparently, I can't spell today. And we're in the post-op period, which is 90 days. And a month later, she comes in to her gynecologist who did the hysterectomy and says, I have a lump in my breast. I just noticed it. I'm worried. Can you check it out? And so the doctor does a whole evaluation and management based around the lump in the breast. Has nothing to do with the hysterectomy. We're going to add a modifier 24 that says what we saw this patient for today was not related to what she had surgery for, because we're still in our post-op period. And we only have to worry about this for the 90 days. Once we get past the 90 days, the patient can come in for anything. Okay. Modifier 25 says significant, separately identifiable evaluation and management service on the same day as a procedure. Again, it says that it's an E&M service, so it can only be added to an E&M code. None of the other kinds of procedures can that be added to. And it's saying that we are doing an E&M and a procedure on the same day. Most procedures have an evaluation component built into the payment. So, if you come in to the office and you say, oops, Doc, look at this. I have this spot. I think it might be skin cancer. Can you look at this? And the doctor does an evaluation and management of my spot. And the doc says, I don't know if it's cancer or not, but it's concerning to me. We need to get it off of your face. We need to do a removal. And we schedule for me to come back 3 days later when he has time in his schedule. So day 2, I come in and we remove the lesion. Okay. And so when I come in on day 2, you already know what you're going to do to me. You didn't have to examine me. You didn't have to make a treatment decision. You just came in, removed the lesion, and I left. 2 different days. Okay? Perfect. However, let's say on day 1, doctor says, we need to take it off. We're going to see what it is. And I have time to do it right now. Do you want to do it right now? And I say, sure. I don't want to have to come back. So this isn't day 2. This happened on day 1. But when I walked in your door that day, you didn't know you were going to do this. You had to evaluate me to make the treatment decision to remove the lesion. This doctor deserves to be paid for both. That's where the modifier 25 is needed on the E&M to get you paid. If you bill it and you forget to put this on here, you will get a rejection. You will not get paid. because the insurance company says, Doc, before you can cut the patient and remove that lesion, you had to look at it. So we're not paying you for an evaluation and management just to pay attention to where your scalpel's going. But that's not what this doctor did. This doctor didn't just look at the lesion to decide where his scalpel's going. He had to do a whole evaluation, a history and exam and medical decision making to decide that that lesion needed to be removed. He's entitled to both payments.